Okay, hello again, everyone. So we're very pleased to welcome you to our Systems Thinking webinar, supported by the NIHR School for Public Health Research and the Evaluating Coastal Rural Communities Active and Sustainable Travel project. So we are delighted to welcome Dr. Evi Seferidi. So Evi is a research fellow at the Public Health Policy Evaluation Unit, School for Public Health at Imperial College London. Her research focuses on food systems and food policy with a specific interest in food system sustainability and system thinking methods. In 2023, Evi secured a 5-year Medical Research Council Career Development Award, focusing on the links between climate change, malnutrition in all its forms globally, and particularly in Peru. Using diverse methods, including a focus on system dynamics, she explores opportunities for triple duty actions targeting climate change, overnutrition, and undernutrition. Evi is also working closely with the NIHR Global Health Research Center for Non-Communicable Diseases and Environmental Change on interventions with dual health and environmental benefits in India, Indonesia, and Bangladesh. Previously, Evi worked on a biotechnology and biological sciences research council funded project that used community engagement and systems dynamics modeling to explore food systems drivers of the double burden of malnutrition in Peru. So I'll pass now to Evi for the rest of the session. Thank you.
Great, thank you. I'm sorry you had to say this whole thing. I'm going to start by just sharing my screen, as you do. And I assume you can all say, but do let me know if you don't. And yeah, I'll start. I actually don't have to introduce myself a lot now after Daniel did all the work for me. But yeah, today I'm going to discuss a little bit about system dynamics. But I wanted to start by saying that, here I have a subtitle. This is a beginner's guide, and this is not because you guys are beginners, but this is because I'm a beginner. I don't have a kind of any formal training on system dynamics. I am getting into using this type of complex systems method gradually the last few years. So I just wanted to share with you my kind of journey or being introduced to this type of methods and how I ended up using them. So please bear that in mind when you're listening to this presentation. But yeah, this is the agenda for today. I'm going to briefly discuss why I chose to use system dynamics, and then I'm gonna give I'm going to give an overview of what system dynamics modeling is, what is the system dynamics modeling process, and then I'm going to present some of our work as an example of this, of applying system dynamics methods. And then finally, and to conclude, I'm going to reflect a little bit on what might be the barriers and facilitators of using such a method in our kind of public health research. So as I mentioned, my background is in public health and epidemiology. And as part of my PhD, I used some kind of simple types of simulation modeling or, I guess, modeling to look at how changes in trade and agricultural policy post-Brexit may impact cardiovascular disease through changes in dietary intake. Right. And I use things like comparative risk assessment modeling, which were very useful in seeing how, changes in a risk factor may change health outcome. But I felt they fell short when it came to really understanding the policy side of things. And that was my main interest. I really wanted to model how policies impact these risk factors. And I didn't have a method to really do that properly. And these were a few things that, didn't allow me to fully explore types of the policy side of things. So, for example, policies many times do not result in their intended effects, right? So we may, introduce sugar-sweetened beverage tax because we want to reduce overweight and obesity in children, and we might achieve a reduction in sugar-sweetened beverage consumption, but this may result, for example, in people shifting to other types of sugary foods or sugary drinks. So we don't really end up achieving our goal of this policy, having an unintended effect. Yeah. Sometimes policies can also have delayed or accumulated effects, or they even act against delayed or accumulated effects. So, for example, poverty or lack of resources may lead to undernutrition, but we know that this will be the result of a long-term exposure to poverty. And by substituting, for example, people's incomes for a month, we won't really solve the issue of undernutrition. So we need to think more in the long term and how this accumulation of lack of resources has resulted in our outcome of interest. And of course, many times how policies actually are made, but also how they really work in practice might not be well understood. We may know how they're supposed to work, but we may need to speak with like the implementers or the policymakers or the people that are impacted by the policy to really understand what's happening in practice. And I think system dynamics can be used to help us understand some of these issues. So I'm going to give you now I don't want to try and give a perfect definition of what system dynamics modeling is. There are many out there that you can look for, but these are just some characteristics that I think are important in understanding what system dynamics modeling is. So first of all, of course, it's a computer simulation model. Everyone might have opinions about the importance of having these types of simulation models over, for example, having more experimental approaches, but they are a low-cost approach in examining different types of policies, combinations of policies, and also a counterfactual. So what would have happened if a policy was not implemented, for example, in an easy way that we may not be able to do in an experimental way. But there are many computer simulation models. So what is specific about system dynamics that it's kind of unique, I guess. So first of all, system dynamics takes a so-called endogenous perspective. What that really means is that when we observe a problematic behavior, for example, over time, we can assume that this behavior is the result of structure, is not the result of individual factors impacting this behavior, but it's more about how these factors interact with each other and the structure that leads to this behavior. And immediate consequence of an endogenous perspective is feedback. I'm sure, especially if you're interested or have used systems-based methods before, or even if you're attending some of the previous talks in this webinar, you've heard about feedback before. Essentially, it implies that it's not only, an exposure and an outcome, a factor A can lead to factor B, but this factor B can lead feedback into this factor A through maybe a different mechanism, creating a feedback perpetual cycle of an associate of a causal effect. Yeah, and this system dynamics modeling really takes this into account and is able to understand and quantify feedback. System dynamics modeling also takes into account time delays, which, it is what the name says. Essentially, it means that the effect of a factor on another factor takes some time to occur. And, we've all considered this in our kind of public health and epidemiology work. We want to model the impact of diet on cardiovascular disease. We will assume that it takes some time for this exposure to actually result in a health outcome. But when we take an endogenous perspective, or when we consider feedback, these time delays may have a more impactful, more important impact. Because, for example, if there is delay in a feedback mechanism, the short-term impacts of a policy may be very different than the longer-term impacts of a policy. And this means that, time delays are important to take into account. And then finally, and importantly, system dynamics use stocks and flows. So stocks are essentially things that accumulate. In mathematical terms, they're integrals, and flows are the rates, the derivatives. But essentially, they're things that accumulate over time. And this can be material. So it can be, for example, people with a disease within a specific population. It could be, people within a hospital, whatever. But it can also be information, and this is quite important. So things like, for example, knowledge, this accumulates over time. Trust, these are things that accumulate over time, and they are not kind of material things. And system dynamics is able to model some of these. And stocks are oftentimes sources of the time delays that we observe in a system. So why are all these characteristics important? It's because according to system dynamics, these are all sources of policy resistance, which is the tendency of a system to essentially resist change through an intervention. And by understanding feedback and time delays and accumulations, we may be able to understand sources of policy resistance and identify why our policies do not work or maybe do not work as we expect to, and reveal some of these issues. So this is all in terms of what is system dynamics modeling, and now I'm going to take you through a little bit the system dynamics modeling process. This is from a business dynamics book from John Stallman. Anyone that's interested in doing any type of system dynamics modeling, this is the textbook for you. And you can see that he presents here 5 different steps of the system dynamics modeling process, but importantly, they're not presented in a linear way. And I've learned these myself. It's actually, we don't start with 1 and finish with 5. There is a lot of back and forth. We need to revisit and repeat many of the stages and so on. So I'm going to take you through each step now. So let's start with the problem articulation, right? So first we need to describe what is the problem that we want to model with our system dynamics model. Of course, first we need to identify our key variables that we think that characterize this problem. But importantly, we need to focus on the dynamic nature of the problem, of how it changes over time, because this is what system dynamics will allow us to explore. And for this, we use reference modes, which are essentially graphs that show this behavior over time. So to give you an example, as Daniel mentioned, I work a lot on the double burden of malnutrition. So for example, if I want to describe this problem, I can just say, there are 148 million children under the age of 5 with stunting globally, 37 million children with overweight under the age of 5. And this gives us an indication of how bad the problem is, but it doesn't tell us a lot about how this has changed over time. But using something like this, which is essentially shows us an overtime behavior, we can actually gain more insight of this problem. We can see that although stunting is an important issue, it has significantly reduced over the years. So there must be something that drives this issue down. We can also potentially say that overweight has been slowly but gradually, increase over time. So again, it's not about how bad the problem is, but it's about if and how it's getting better or worse. So this is the problem articulation stage, and then we move on to the dynamic hypothesis, which is it's generally a theory, a conceptual framework of how we think the problem that we want to model has occurred, always using an endogenous perspective. This is why we're using system dynamics, because we think that an endogenous perspective is important. And it can be informed by, literature, but also views from experts or other types of stakeholders, using different tools from, systematic reviews to informal consultations, to more structured methods like interviews, to specific methods that are designed to elicit systems, structured systems ideas like group model building, which you might have heard before in some of the previous sessions that we had. And this dynamic hypothesis is presented many times diagrammatically, either as a causal loop diagram or as a stock and flow diagram. So I assume most of you know what the causal loop diagram is. This is just an example for some of our work. But what I want to highlight is that based on what I just said about what is incorporated in a system dynamics model, the causal loop diagrams gives us some of this information. It shows us where there are loops. It shows us where there are delays using these kind of parallel lines. And a stock and flow diagram is again a conceptual representation, but it uses boxes to show stocks or accumulations, and these more like thicker arrows to show flows. And again, it also shows things like loops or delays, but it also shows where we think accumulation exists within a system. Okay, so we have a dynamic hypothesis. We have a conceptual framework of how we think the system that drives the problem we want to model works. And then, we can go into the formulation stage. It's hard for me to give kind of specific steps on how this is done, but these are some advice, some tips that have been given before that I found useful. The first thing, and very important, is to start small. Many times we might have a very complicated kind of dynamic hypothesis with many, many different variables, and we think we need to kind of quantify everything from the beginning, but this is not possible. We need to start small and make sure that we start with the working model. It's important to have a model that simulates and runs as expected. We can identify stocks and flows, so things that accumulate, and this is crucial. We cannot have a system dynamics model without stocks and flows. We identify auxiliary variables or endogenous variables, so essentially variables that are impacted by or they are the result of other variables within the system, but also constants or exogenous variables, so variables that are just informed by data. We use equations to essentially inform how the different endogenous variables are informed by other variables, and also data to inform our model. And then we start over. We incorporate more structure, more variables, more information, going into an iterative process. Again, I think if someone is interested in doing system dynamics modeling, they need to, search for different resources. I think I mentioned this book, Business Dynamics book. This is, a very comprehensive guide on how to do system dynamics modeling, both providing, a theoretical understanding, but also very practical tips of the different processes. So I really recommend this. It is hard sometimes for us as public health researchers to relate with some of the examples used because system dynamics use a lot of kind of examples from business world and so on, but I still think it's a very, very useful tool. And there are some other things like system archetypes, which are essentially structures of behavior that structures of a system that lead to a specific behavior over time that we commonly observe around the world, that we potentially can inform our model, but they're more like structural. And then we can have things like molecules of structure that are more kind of quantitative, small models, or more accurately, I guess, model building blocks that lead to a specific behavior over time that can also be used to inform our modeling our kind of formulation stage. And I found this quite useful. I have here a website if people use, and they have some structure from Stella. If people use the software, if people use Vensim, molecules are incorporated within. When you download the software, you have it as well. But this website as well has more of a general kind of indication of the different equations that are used and so on. So these are just some modeling tools, but if you have more, please, like at the end of the presentation, share this with us. That would be very helpful. And then let's talk a little bit about data, because as I mentioned, part of the formulation process is to identify data to inform our variables. And you can see here, we have three different types, I guess, of data. We have a numerical database. I think this is what most of us are, aware of and comfortable with. There are things like, maybe time series or, cross-sectional data, whatever, that we can use, of course, to inform a system dynamics model. And although they don't come without limitations, they tend to be more accurate, let's just say that. But at the same time, they are very limited. If we think what makes out our world, very, very few things we have actually managed to quantify and measure and provide data for. So we might not be able to really quantify everything that we include in our conceptual, kind of in our dynamic hypothesis. Then we can have the written database. So this will include, things like archives, let's say, policy documents, or even maybe narrative reviews that give a description and understanding of how things work, although not strictly, numerical. And we have more information on that. More things are described in a written way, and can inform our model. And then finally, we have our biggest database, which is the mental database, which, we have data for most of the things around the world, which are, as most of us have a mental model of how we think something works. And this, can include things like goals, beliefs, things like that. And this is a bigger database that has obviously its own limitations as well. So these are, I guess, some different types of data that we can use. And so we have our questions, we have our data, we kind of have a model that simulates some results, and then, we need to do some testing. And I'm sure we've all had this phrase, all models are wrong, but some are useful. And I think this is something that we need to consider during our model testing process. We're not going to prove if our model is, correct, because it's not, it's wrong. We know that. But can we see if it's useful? And importantly, is it useful for its purpose? So it's important to understand its purpose while we're doing the model testing. A model that is used to, predict disease over time will have a very different purpose than a model that it's used to understand a policy, process or a decision-making process. And having that in mind, I think it's very important throughout our modeling kind of process, of course, but also during the model testing. I'm not going to go into too much detail on like the different ways that we can do different tests that we can do. All of these are in the business dynamics book, so feel free to look in more detail. But the way I understand these different tests, there are tests that include testing or looking further into the structure of the model. Like, is our boundary adequate? Does it include everything that we need to understand our behavior over time of the problem we're modeling? Maybe we include more things that are not needed. Is our structure, does our structure represent kind of an understanding of reality, let's say, of how things work? There can be tests that are related to the formulation of the model, things like dimensional consistency. Every variable in system dynamics model has a unit, and we need to make sure that the equations we're using to inform the different variables result in units that make sense in real life. Parameter assessment, checking if our parameters are correct, are represented in like a real world situations. We're testing sensitivity of our model under different integration methods or different time steps and so on. And then we have several tests to test the behavior that the model produces. Does it reproduce observed behavior? Does it work as expected under extreme conditions? But if we have no births, we shouldn't expect our population to rise. If this happens, something is wrong. How the model works across different types of populations, if it produces any behavior that is not expected, and so on. So yeah, and the final step is the policy formulation and evaluation, which is maybe the reason why we've done all this work, probably to understand how policy may impact the behavior over time that we observe. Many times we actually need to incorporate essentially some formulation into these steps, expand our model to incorporate the policy design or the decision-making rules and so on. But essentially, we can use it to test different what-if scenarios, what will happen if we make different changes, and we can do that across different intervention levels. I think probably a lot of you have heard of the Donella Meadows leverage points framework, which essentially says that in order to change a complex system, to tilt the scale, there are many different things that we can change with increasing effectiveness. We can change things like, values, constants, parameters that may have a small input, because as we said before, in system dynamics, what drives behavior is structure. But we can also change things like, feedback mechanisms, delays, they might be a bit more effective. But to really see an important change, we might need to change the whole organization and structure of the system, its goals, its paradigms, and so on. So things like we can use frameworks like that to inform our different what-if scenarios, but also, other types of scenarios can also be implemented. So yeah, I think that's all in terms of how it works. I guess like a more of a theoretical description of the system dynamics modeling process. And now I want to use our own example, our own work to take you through this process and how it worked in practice for us. So this is a project that was funded by the Biotechnology and Biological Sciences Research Council that focused on understanding the double burden of malnutrition in Peru. It was a collaboration between us here at Imperial College and Crónicas in Peru. And we also had two partners from Colombia, Universidad de los Andes in Colombia, and the Social System Design Lab in Washington University in St. Louis from the US, who have a lot of experience in system dynamics modeling and also engaging with stakeholders to inform system dynamics models. And they were very crucial to this project. So the aim of the project was to understand the food system dynamics that contribute to the double burden of malnutrition in Peru and inform opportunities for double duty policies, so policies that target double burden of malnutrition using community-based system dynamics. Um, so, let's go back to our modeling process and see how we implemented that. And we start with the problem articulation. I'll first give you some background. So for those of us that do not really know what the double burden of malnutrition is, it's essentially the coexistence of undernutrition, like wasting, stunting, anemia, and overnutrition, like overweight, obesity, or diet-related non-communicable diseases within the same individual, household, population, or throughout life. And, this is a WHO definition. And as I said before, it's a good definition, but does it really tell us what we need in order to describe our problem for a system dynamics model? No, we need to focus on its dynamic behavior. We use data. So first of all, we focused on kind of population level double burden of malnutrition, and we focus specifically on overweight and stunting. Here I have data from women of reproductive age and children under the age of 5, but the model did not include only this information. We looked at how overweight and stunting coexist at population level in Peru. And in order to describe the problem for a system dynamics model, we're using reference modes, behavior over time graphs. And what we can see is that actually, overweight in Peru has increased over the last 20 years or so, more rapidly maybe than what has happened on average in Latin America. Stunting is an important issue, but has also decreased significantly, especially in it has increased similarly, but especially in the rural areas, it has a more rapid decrease, although it's still a significant issue. So we describe our problem and then let's move on. As I said, this is not a linear process, so it's easier for me to describe our own kind of process or how it worked in practice. And this is the flow chart of what actually happened. So we started with a dynamic hypothesis that was mainly informed by literature, which was then formulated into a model. And then we went back into another type of expanded our dynamic hypothesis, which was then formulated into a model and tested doing policy analysis. And actually now I'm finding myself back into the model formulation and testing stage. So as I said, it's an iterative process. Also, good opportunity to say that this is not a finalized piece of work. It's a work in progress. It hasn't been published or shared in any conferences or anything. So I'm very open to your thoughts about this too later if you want. So, okay, let's take a step separately. So we started the project with, after the problem articulation, doing it like creating a dynamic hypothesis. I was mainly informed by literature. At some point, we also kind of had a short consultation session with a couple of experts, but essentially we used this kind of hybrid stock and flow diagram to show our understanding of how stunting and overweight occurs, also taking into account its intergenerational transmission. So we know that stunted children may be more likely to become short-stature adults, who may be more likely to give birth to children of low birth weight, who are more likely to become stunted, creating this kind of feedback loop of stunting. And something similar we might observe for overweight, either through neonatal characteristics or just parents sharing their own similar dietary kind of habits. And then there is some evidence that shows that actually also stunting at early age may lead to overweight or obesity later on in life and so on. So we have this preliminary kind of dynamic hypothesis in the form of a stock and flow diagram. And then we moved on into formulating this into a quantitative model. We use aging chain structures. If you look at the molecules, you'll find this there, but also the Sterman book has a really good explanation of what aging chains are. We use a co-flow structure to essentially simulate the overall population in Peru and also the overweight and stunted population over time. We just used epidemiological data on population, overweight, stunting, and so on, some associations from the literature. We did not quantify all the associations that we hypothesized in our dynamic hypothesis because we might, not have data, or through the process of testing, we didn't find that it was relevant and so on. But anyways, we created a model that kind of simulates behavior over time of overweight and stunting in Peru. And, that's okay. But how is that useful if we think of the purpose of our model, which is to see how, food system policies can really change or improve this problem? And this is not really informative. It cannot tell us much. So we went back into the dynamic hypothesis stage to really ask what are the food system drivers of the double burden of malnutrition in Peru. And we went to different types of stakeholders to help us with this. I'm going to tell you later what type of stakeholders we engaged with. I'm not going to go into too much detail on this part of the work because we just published a paper that explains this in in much detail. If you're interested, describes essentially the development of this dynamic hypothesis. But briefly, I'll tell you a few things. So we did 5 different workshops in 2 different regions in Peru, in Lima, which is the capital, and Iquitos, which is big urban city in the Amazonian jungle. We engaged with different types of stakeholders, including parents of infants and school-age children, health service providers and researchers on nutrition, representatives mainly from NGOs that focus on nutrition issues, and also policymakers. We did 4 different workshops. 4 different workshops in Lima. Each workshop engaged with a different type of stakeholder, and then 1 longer workshop in Iquitos with local stakeholders of different types of stakeholders. Each of these workshops came up with a causal loop diagram, which was like a dynamic hypothesis. And then the research team, we brought everything together and we synthesized 1 dynamic hypothesis, which we then shared with these participants through an online kind of model review session. So we tested the structure and we came up with a causal loop diagram, which looks like that. Again, I'm not going to go in much detail, but I'm going to point out that we can see here things like loops, things like delays, things like accumulations. So now we have a much more complex kind of dynamic hypothesis that incorporates kind of food system structures, and we can move on into the formulation. And this is where the start small advice really came in handy, because it was very overwhelming to think of simulating such a huge model. But it's not. I'll give you just as an example to show you how this might progress. Might not be really what happened, but might give you an understanding of how we went with a dynamic hypothesis of like a qualitative understanding of a loop here into a more complex thing that shows the same thing, but also takes into account accumulations by including stocks and flows, and adds more endogenous variables, which are really informed by a bunch of other exogenous variables that in the end might be endogenous when we start building our model further and further. So it is a process of expanding by adding more information in order to quantify our dynamic hypothesis. So after, we did some formulation and we had a working model that produced some results. So we decided to do some testing. So we did some kind of structured testing where we went back to our kind of participants of our workshops in Peru, and we shared our structure. We shared some of our results. We asked their opinions and feedback of, if the model represents more or less what they had in mind. We tested how the model kind of reproduces over time behavior, mainly focusing on how things change over time. We tested different extreme scenarios. So, what would have happened if there was no policy at all implemented, or what would have happened if there was no presence of food industry? Does the model produces what we expect it will produce? And then after we're kind of happy with our tests, then we can move on to our policy formulation and evaluation stage. For this, we did use the Donella Meadows leverage points framework that I described before. But the scenarios were also informed by existing policies or recommendations for policies in Peru or more globally, and also importantly by the structure of our model. So I think maybe the best way to explain to you the scenarios is if I tell you the story of what the model shows. So bear with me for a second while I show you that I use this causal loop diagram to explain what's the story that the model says. So essentially, as I mentioned before, Peru has managed to reduce stunting significantly over the years. It is widely considered a success story when it comes to stunting reduction. And this has led to actually a prioritization of undernutrition over overnutrition in the kind of policy seen in Peru, with things like resources for evaluation or keeping track, I guess, of stunting and in the country and so on. This is actually informed by by a systems archetype called success to successful, where resources tend to go towards things that are, that have shown previous success, even if the problem have shifted. So this prioritization of undernutrition leads to more political willful undernutrition, which leads to more undernutrition policy, which acts against stunting mainly through social policies, but a little bit as well through food assistance programs that provide healthy food that can improve and undernutrition, but at the same time, sometimes they also provide unhealthy food, which can unintentionally increase overweight. And then this prioritization, as it increases resources towards undernutrition, it will reduce resources towards overnutrition, which will reduce overnutrition policy. And this overnutrition policy in Peru acts against overweight through by targeting unhealthy food consumption, like ultra-processed foods, for example, through marketing restrictions or warning labels in packaged foods and so on. And this reduction in unhealthy food consumption means that the food industry profit might increase. So they will do something to balance out this overnutrition policy action, for example, through industry lobbying or by investing more resources towards marketing and production to further increase unhealthy food consumption and overweight. So this is the story of what our model says. And I thought it's important to explain this to help you understand the different scenarios that we modeled and what these mean. So let's say, we still have this general methods framework. We would try to think the list, different scenarios and different intervention points. So the first scenario, we'll just assume that we'll change the policy mix. There are different ways to kind of target overnutrition and unhealthy food consumption through overnutrition policy, let's say through marketing, price, availability. We can play around with these kind of exogenous variables that define the policy mix. Maybe we can, act against delays. Delays. As I mentioned, there might be delay between the decision, the will to make actually policy against overnutrition or undernutrition, and actually this policy being implemented. So, what would happen if we, reduce this delay? What would happen if we remove some of the feedback? For example, we remove feedback loop B1, so there is no industry lobbying anymore, or we remove feedback loop R4. So under nutrition policy, they only provide healthy food, so they do not unintentionally impact overnutrition anymore. But the most impactful, potentially effective policy might be when we change the whole system. So when we create something like that, when we move away from this prioritization structure and we go into a new type of thinking about policy, where we think of overnutrition and undernutrition as not like the things that are competitive, but as, acting against them, against, different, goals that we want to achieve, creating double duty policies that act both against overweight and stunting. So this is a complete transformation of the system and its goals and how we understand it. And indeed, when we run these models, we can see that not many policies can actually help this increase on overweight that we observe. And the only way to really start seeing a reduction in overweight is if we really transform the system in our last scenario through double duty policies. At the same time, any effort to further work against overweight, for example, by putting more resources towards overnutrition policy, may have an unintended side effect on stunting, because there will be less resources for stunting, and maybe it will hinder our progress when it comes to stunting. But by completely transforming the system, we might continue to see some progress for stunting as well. So this might be a good time to think a little bit, how we can use these models and what these results and how, what's their usefulness essentially. This slide was made by Alice Ballard, who was our colleague from Washington University in St. Louis. I think it showcases what is the use of a model like that? We can use it to build a shared language of what are the drivers of the double burden of malnutrition in Peru, having an endogenous perspective, so developing this systems-based approach towards understanding the drivers of the double burden of malnutrition, taking into account feedback and delays and accumulations. We can test our existing assumptions of how our policies work. We may be able to identify opportunities of how the double duty actions may occur in Peru, but we cannot use it to predict overweight or stunting prevalence over time. We cannot use it, for example, to make, budget allocations or resource allocations, projections. We cannot use it to produce kind of to predict future impact of policies using the simulation results. And having this in mind can really, it's important to have that in mind so we don't misuse these types of models. Um, and I think that's my last slide to reflect a little bit on how this kind of process has been for me and our group here at Imperial. Definitely a big barrier is that in order to implement this type of work and models, we need a multidisciplinary team and we need some modeling expertise. I think it's very hard for someone that has, is just learning to do system dynamics modeling to implement these types of models without any support from some people that have more modeling expertise. But also we need a kind of a personal investment in like the time that we need to really, build this skill to do a completely new type of model, but also get into almost a new way of thinking, let's say. Another important challenge I found is that it's hard sometimes to avoid this kind of black box modeling, right? When we don't really, there is a very complicated structure of a model, and we really struggle to communicate this to the model users. And there are some ways to do that, but I find it quite hard just because we have so complex models with many variables and assumptions. And of course, data requirements, I think this is a common issue. But, especially when it comes to finding the right balance between using the most of your numerical data, but also using some data from like our mental models or written data and so on. But there were also so many benefits in using this. Of course, if we think that, we can use this to really explain dynamic behaviors. And if we think that there is some policy resistance that may derive by what we've described before, like accumulations and feedback and delays, system dynamics can uniquely help us achieve that and inform that. And also, I thought it was very useful, although it did come with many challenges, that we can involve the users of this model throughout the process, from the development of the hypothesis throughout to kind of its use too. So I think I'll finish here to have some time for questions and discussion. Thank you.
Okay, thank you so much, Evie. It's a brilliant session, and I can see applause coming in already. So yeah, thank you again. So I'll open up the floor. If anyone has any questions, I'll check the Q&A section as well. But if anyone would like to raise a hand or just to unmute and ask your question, please feel free. But yeah, I'll open it up to the floor. And perhaps I can start with a question of my own. So, of course, you mentioned that how this is like a sort of a beginner's introduction to system dynamics, or a beginner's presentation of system dynamics. And for myself as well, I've been recently introduced to systems thinking, systems dynamics. So I think my interest is, my question is, if you're able to expand more on the decision you made to go towards that system dynamics approach. You mentioned the importance of the endogenous perspective within system dynamics. I wondered if you can expand more on how system dynamics contrasts with other systems thinking approaches, if there's anything you can say on that.
With other systems thinking approaches.
Systems thinking, well, yeah, within other systems thinking approaches, how system dynamics contrasts holding that endogenous approach as being central.
Okay. So, I mean, I don't want to speak about all types of system thinking approaches because I don't know much about it. But when it comes to some of the things that we've had before in these sessions, when we talked a bit about causal loop diagrams and just more generally about systems thinking, I think essentially system dynamics is a way to implement some of this more theoretical and qualitative understanding into, a more quantitative approach, essentially to see how these, let's say, feedback or delays can lead to changes in behavior over time. When we have a causal loop diagram, we can assume potentially, what we what parts of the system may impact our model, but we cannot really see in what way they're going to change our behavior over time. So this is what system dynamics can add to that, but it's just an addition. I think is an extra tool, and I think you can see when I was taking you through the system dynamics modeling process, how well intertwined is the formulation of which is what we might have in our head as system dynamics modeling, with actually the conceptualization, which might use things like causal loop diagrams, which is a very important part, and actually they go hand in hand. So I think it just gives us a further understanding of how all these kind of drivers can lead to a change in the behavior over time. I don't see them as two separate things. Other methods like agent-based modeling potentially, and social network analysis, I think all these kind of things also fit under the systems thinking umbrella, but I won't comment on these because I don't know much and I don't want to say anything that might confuse people further. So.
Yeah, that's fair enough. Yeah, and I
Yeah.
think absolutely true how well I could see from the whole of your presentation linking into causal loop diagrams, group model building, and other sessions that we've touched on, which I can expand on further shortly. But yeah, thank you. I'm not sure who was first, but I can see Alan and Miriam. Maybe I'll pass to Alan if you want to come in with your comment or question.
Thank you. Hi, Evie, Alan Brennan from Sheffield. Nice to meet you. I think I wanted to ask you what you thought of the slide that you put up by Ellis Ballard, which was the only slide that you hadn't done, and was the only slide that I was disagreeing with.
I see.
So, I mean, effectively, the slide before uses some what-if scenarios to make some estimates of the effects of changing policy or system. And then Ellis says in red, you can't predict the next years or use projections to predict future impact of policy. For me, the most important thing in life is to use modeling to help estimate impacts of policy and inform policy decisions. So I kind of feel like it's potentially possible for you to misuse simulation modeling or systems dynamics modeling. But if the model actually fits well to the trends and you've demonstrated some form of validity that your structure of the system can actually predict what happens in the past or whatever, then it's almost morally on us that we should use it to inform policy. Otherwise, why did we do it? So I don't know what your thoughts are on all of that. A little bit philosophical.
Yeah. No, completely get that. I think, I mean, that's a great point. First of all, let's just say that Alice made that specifically for the model that we developed, right? So other models might have different uses, and some of them may be used to predict overweight and stunning prevalence. I think what I get from this, and I try to convey that by the way that I describe these results, is that what we can see is how these different what-if scenarios change the behavior over time that we observe. So I never said, there was a 20% reduction in overweight, or, by 2040, we will have 10% reduction in prevalence. Because what this model really shows is if, compared to a counterfactual where things, are done in a specific way that we described under a baseline scenario, can we see a change in the behavior that we're expecting? Will things continue to get worse? Will continue to, they might become better, they might stay the same. And I think this in some way can inform policy, right? If we see that something gets worse, we probably need to change something. And the model might even be able to tell us what is the thing that makes things worse and how we can intervene to that. But I think it's important to clarify that we wouldn't give specific kind of quantification of this effect in order to inform how many million, dollars we need to invest for a specific policy to prevent a specific amount of cases or deaths or something like that. So I think having this in mind. This is more about how a problem becomes better or worse rather than how bad a problem is. It's important to clarify. But again, this is not for all types of system dynamics models, and some of them may be able to inform these types of policy decisions. Hope this answers your question. Yeah.
Okay, thank you, Alan. Miriam, do you want to come in?
Sure. Thank you so much. I really enjoyed that presentation, and the way you brought it to life with the example was really helpful. I have a lot of questions. I'll just ask two of them for now. Could you describe at what point or how maybe you identified the success to the successful archetype as being especially relevant? Was that something you had in mind from the outset, or did it kind of emerge from the detailed CLDs, or could you give us some flavor of that? And my second question is, how did stakeholders respond to the scenario modeling results? And, were those findings surprising, or did people kind of express insights related to them? Thank you.
Sure, great, thanks. So for the first question, we did not, I haven't thought of that at all, actually. But it did come up in a specific stakeholder workshop in Lima, where people were just describing how, all these resources go towards stunting and or undernutrition all these years. Okay, we know it works, but we don't have money to actually evaluate policy against overweight, or we don't have money to observe how overweight changes over time, and this is why we cannot convince our policymakers about this. So it was more like people telling this story, and then it just fitted very well to the success of the successful archetype. And it was really revealing to me to see that actually, indeed, some of these archetypes we can actually observe in real life. So yeah, we didn't bring it in at all. It just came later during the synthesis stage. And then for your second question, I think there was a big challenge in our case, which maybe partly be because, we did some of these workshops during the pandemic, some of things needed to be done online and so on. In terms of the consistency of participants in in-person workshops and online workshops. And this meant that actually when we shared the results, some people, were potentially maybe surprised by some of the structure. There was more discussion about things that we may have missed, which I think was the result of just having people coming in and out of different workshops. But I thought it might have been the way that we structured this. It was a lot of discussion about the structure, which essentially was the whole issue of what was the aim of this session, rather than actually focusing too much on the results of the simulation model. So yeah, I don't think that there was more discussion about what was going on in terms of the structure, if there were things omitted, if there were more things to add in. But yeah, I think a way to mitigate that and have a better understanding would be to have more consistency of kind of participants across different sessions as well, which is very, I think, not easy to do. But yeah, hope that answers your question.
Yeah, perfect.
Okay, thank you, Miriam. I'll just take a moment to see if there are any other thoughts or comments or questions. I'll check the Q&A just to make sure I haven't missed anything.
I can come in with another question if not.
Yeah, sure. If you want to come in, a brief question, if possible.
There's so many different types of model tests. Could you describe how you documented all of the model testing or kept track of it throughout this iterative process? Yeah,
that's a great point. I think what I found is actually a lot of the testing happens kind of informally while you formulate. I don't think I've ever done, a day of only formulation and no testing. But yeah, I think it takes a lot of time to then really put this down in writing, and you can include it. I have a format if you want, I can share with you later. But I think in the end, I'm not kind of putting down all the tests that I'm doing while I'm formulating, but then in the end, I will have different tests, and then I will note this down, essentially explaining what was the test that you did, like what this included, what scenario, for example, you modeled, some simulation results potentially, and what was the observation, like a more of a qualitative understanding of what that meant for the model and what was your conclusion kind of thing. So I had like these 3 columns of the test, but I would do that like towards the end after I've already done a lot of informal testing while I'm formulating, which I'm not really kind of tracking down in too much detail.
Great, thank you.
Thank you. I think we can probably bring it to a close. So thank you again, Evie, for an excellent session. And I think we've already mentioned how well this session has mapped onto our previous sessions. I just noted with the problem articulation, go see group model building, a session that we had from Janina earlier this year on dynamic hypotheses. We had a session on using causal loop diagrams to build for hypothesis building and evidence synthesis, model for formulation, different sessions we've had on causal loop diagrams. And then also going towards our next webinar where we'll be looking at leverage points. So thank you, Evie. That's really sort of covered many of the points that we've presented as part of our series. So as we mentioned at the beginning, this session has been recorded and will be uploaded to our YouTube playlist. So this is a resource that will be available for everyone to catch up on. If you've missed any of our previous sessions or you would like to have a refresher, it's all available on YouTube. So yes, as I mentioned, next month we'll be joined by Dr. James Nobles. I will send out the details for that session shortly. But in the meantime, thanks again, and we look forward to hopefully seeing you soon. So thank you, everyone, and take care.